Welcome to this video. My name is Christiana Mausi Sarah. I would like to talk very briefly about some of the complications of diabetes, specifically the type 2 diabetes. These days, a lot of people are living with diabetes. Some have been newly diagnosed, and some are living lifestyles that put them at very high risk for developing diabetes. So what happens? What are the complications? Possible complications of diabetes mellitus. Now, it's very important to know that these complications often happen quickly if your blood sugar is not controlled, well. So how will this happen? If you do not take your prescribed anti-diabetic medications on time, if you do not keep your medical review appointments so that your doctor can examine you, run some tests to see the progress you are making regarding managing or controlling your blood sugar. So you just have to adhere strictly to what your doctor tells you, your diet, exercise, and everything. Okay, so before somebody is diagnosed as having diabetes, there are several type 2 diabetes. There are several types of glucose tests that can be done on the person. I will only mention two of them. The first one is fasting blood glucose test or fasting blood sugar test. And this is usually done at least 8 hours after the person has had, his last meal. So at least you might have had your last meal 8 hours ago before you do the fasting blood sugar. And usually, if your fasting blood sugar is 7 millimoles of deciliter or more, so 7 or more, then it is termed as diabetes. It means you have diabetes. The normal fasting blood sugar should be between 3.9 to 5.6 millimoles of deciliter. Then the second test is random blood sugar test. Now, this one can be done at any time, and it's random because you might have eaten before the test is done. However, if your blood sugar level, your random blood sugar level, the test results is 11 or more, that can also mean you have, that means you have diabetes. So please take good care of yourselves. And usually the random blood sugar test, it is assumed that after 2 hours, your blood sugar level, when tested, should be, around maybe 7.8 thereabout. It should be below 11, far below 11. So once it's 11 or more, then it means you have diabetes, type 2 diabetes. And you are prone to the following complications that I want to talk about. Okay, so let's look at the complications. The first one is hypertension. Yes, diabetes can lead to hypertension if your blood sugar level is poorly controlled. So how does this happen? When you have diabetes and your blood sugar level remains high, the high blood sugar level destroys, it causes scar tissues in your kidneys. And once there are scar tissues formed in your kidneys, the kidneys are not able to function as they should. It means they become hard. So when the kidneys are not functioning well, it leads to retention or buildup of water and salt in your body. And once there is buildup of water and salt, there's fluid buildup in your body, it means your blood volume also increases. So now your heart needs to pump with a harder, pressure, harder force to be able to push blood to your various parts of your body. So eventually your blood pressure will have to go up. So if you are already hypertensive and diabetic at the same time, please adhere to medical treatment so that your hypertension is not worsened. Second complication is kidney disease or kidney failure. I spoke about that already. So the high sugar level causes scar tissues to form in the internal structures of your kidney. So the kidney becomes hard and thickened. So it loses its function. It's not able to function well. So the person can have kidney failure or kidney disease. Then the third one is retinopathy or blurred vision or blindness. High blood glucose level can damage the blood vessels in your retina. That's the back of your eye, the inner part of your eye. It can damage the blood vessels, swell up, and they begin to leak fluid into the back of your eye. And when this happens, it could even stop blood flow to that part of the eye. And your retina is very important. It's the part of the eye that is light sensitive. So it picks the image of whatever you are seeing and then sends the signal through the optic nerve of your eye to your brain. Then it interprets whatever you are seeing. So it is very, very important part of your eye. So it could result in blurred vision or blindness, total blindness, if it is not managed quickly in a timely manner. Then the fourth one is delayed wound healing or poor wound healing. Yes, consistently high blood sugar level. What it does is that here again it destroys the tiny blood vessels in your body. So when this happens, it means it slows down the flow of blood to the wound as well. So oxygen to the wound is reduced. And remember, the high blood sugar level also affects the function of the red blood cells and the white blood cells. And you need all this for wound healing. So if the red blood cells are not able to get to the wound, it means oxygen is not reaching the wound as well. So the wound will not heal and eventually could lead to infection. And in most cases, the person's limb gets amputated. The last but not the least is nerve damage or neuropathy. So consistently high blood sugar level or diabetes could result in nerve damage of the nerves in your feet and your body. So sometimes it could lead to, and in this case too, it destroys the blood vessels that supply your nerves. So once there is no supply of nutrient blood, the nerves lose their function. So at a point you realize that there is numbness or tingling. You don't feel anything in your leg or your fingers again. And that predisposes you to injury, because if something is hot, you just step on it or you just touch it and then you get injured. And because of the diabetes, the wound cannot heal fast too. So at the end of the day, your leg is amputated. So please, let's take good care of ourselves. Control your portion sizes, avoid high carbohydrates, eat more of complex carbohydrates, more fruits, vegetables, avoid late night eating, and please exercise, take good care of yourselves. Thank you, and please watch out for more videos. Bye.